So let us continue Nash Therapeutics study streak for 6th March. We have a very crucial remedy which Dr. Nash discusses uh, in his Leaders in Homeopathic Therapeutics, which is Ferrum Metallicum. So, what does he say about Ferrum Metallicum and what are his ideas? What are his inspirations for all of the homeopaths? Let us go through it. The first line that Dr. Nash mentions is that it is another one of the abused remedies. Now, you can understand from the scenario that he was in at the time of writing this book. And I have also earlier told that whenever we read an author, we have to first read the preface and the time or the era in which he has written the book, and what was the condition of medicinal practice, homeopathic practice in that era. And what Dr. Nash writes about ferrum metallicum is that it was one of the abused remedies of that time. So you can understand that in the old school, in the modern school, this remedy was given left, right, and center to all the patients who had anemia. And that is where the drugging, concept began. Because this was in 1890s or 1900s when he has written the book. And this methodology continued from that time because that was the discovery of new drugs, chemicals, components, and pharma lobbies and everything. And this continues even today. This trend continues even today. So it's very important for us to know what were the trends of medicine at that time, what were the trends of homeopathy at that time, and how our author has written about these interesting concepts which he understands. So for ferrum metallicum, Dr. Nash writes it is one of the abused remedies, another one of the abused remedies of that era. And that was one of the satisfactory things for all old school practitioners to resort into because it was the easiest method to give iron tablets and finish off the anemia. But what Dr. Nash writes in his book Leaders in Homeopathic Therapeutics, he writes almost 2 pages just introducing this remedy so you can understand how widely it was abused and not properly used in that era. So he writes that there was this kind of a treatment of anemia, which was one of the most satisfactory things. But ferrum metallicum as a remedy would help only in cases where there is chlorosis from defective menstruation or there is simple poverty of blood induced by hemorrhages, or there can be deficiency of air, light, or suitable food which overlapped or consumed the patient, and also there was an exhausting disease. So all these factors contribute to the existence of the deficiency in the person for a long time, which is where iron should work and not in all cases. Again, he quotes Dr. Nash, quotes Dr. Hughes, that there is this kind of a fault in the assimilative process rather than anything else which should be attributed to the prescription of ferrum metallicum. And if it is given in extra quantity, we know today we can read the side effects of the remedies in the all the literature available online or in the books. that if iron is given in excess quantity, it will kind of eliminate in the feces. And this is what our stalwart Copperthwaite also wrote about iron as a overdosing element that will disrupt the feces of the individuals. So Dr. Nash then goes on to describe that he has cured lot of cases of anemia by natramure in potentized form than he did see iron in any form. And this is an inspiration for all of us who are giving or resorting to biochemic methods, or also giving supplementary treatment to such patients who can just be corrected by few doses of natramure, or even pulsatilla, ferrum metallicum, cyclamen, calcarea phos, carbovate, china. So Dr. Nash quotes all these remedies to help in all the anemic cases rather than just natramure. But he has seen natramure helping more in all the anemic cases than any other remedy. Should serve as an indication and inspiration for us to pick up something which is, invaluable from Nash Therapeutics today. So now next what Dr. Nash tells us is he tells what indicates ferrum metallicum for us to prescribe ferromet in potentized form in patients. The first thing what he starts with is pale greenish face, and face becomes bright suddenly. He quotes Rauhe pathology. Then he quotes Kunsi, who says that least emotion or exertion causes a red flushed face, and rush of blood to the head. Veins of the head are swollen and there are flushes of heat in the face. There is hammering, beating, pulsating pains in the head, which is also there in belladonna, china, natramure, glonoine. And then he again goes, Dr. Nash quotes again Rauhe pathology, where Rauhe has quoted and told that great paleness of mucous membranes, especially cavity of the mouth. So all these things are directly observable by homeopaths when the patient enters the clinic. And we need not even wait for the patient to utter a single word. This is where all the homeopaths of our olden times were sharp at. And today we are all relying on different methods and repertories and rubrics and ways to understand their symptoms. So this is what I want you all to learn today, which is by observing the patient itself, you should be able to find out the symptoms of the remedy, at least get an idea of the symptoms of the remedy. And then lastly, he quotes that the patient is always better by walking, notwithstanding the weakness which obliges the patient to lie down. Menses too soon, too profuse, too long lasting, with fiery red face, ringing in the ears. So you see that this ringing in the ears is also a common symptom, or mostly observed or seen in China as a remedy. And ferrum metallicum is another remedy. And the flow is pale, watery, and debilitating. So what should be the symptoms that should classify into giving to irregular menstrual cases? All these concomitant symptoms, that there is ringing in the ears, there is pale face, there is debilitating or watery flow. Many patients will come to the homeopath telling that the periods are irregular. Sometimes they come too early, 25 days, sometimes they come too late, 32 or 35 days, or even 40 days. This is nothing but too soon and too late. But if it is a case of too profuse and also too soon and lasts for a long time, like 7 days, 10 days, then ferrum metallicum is to be thought of. If there are also concomitant symptoms, which is fiery red face and ringing in the ears. So Again, Dr. Nash tells us that the old school will sometimes overdose the patient with iron, but homeopath should individualize and antidote those symptoms which he sees from those patients that have come from the allopath, and then think whether ferrum metallicum suits the patient or the other remedies that he has given. And that is where he tells that you should think of iron in localized congestions and hemorrhage from organs. There is hemorrhage in anemic and debilitated subjects, which Dr. Nash tells us. And next, Dr. Nash again goes on a list of 5 to 7 symptoms which are important for prescribing ferrum metallicum, and that is the canine hunger, which is also alternating with loss of appetite. China is one of the other remedies which also has canine hunger, if you observe. So, this is what you should understand and prescribe and differentiate remedies when you need to understand. So ferrum metallicum not only does it have canine hunger alternating with loss of appetite, but also regurgitation of food or eructations after eating. All the symptoms of ferrum metallicum, whether it is fever, whether it is cough, whether it is menstrual periods, whether it is respiratory troubles, gastric troubles, uterine troubles, urinary troubles, they will have an element of regurgitation of food or vomiting, and you will see this in all the areas of the ferrum metallicum as a remedy. So there is this kind of an improper or irregular distribution of the circulation and the other nutrition, or the exact place of certain things are not there. Then Dr. Nash goes further and tells also that the patient wants bread and butter and does not like meat. And this is exactly what we see in most of our patients. They want bread and butter. You should think of ferrum metallicum as a remedy. Normal repertories, I don't know whether this rubric you will get it together. It's bifurcated into 3 parts. But if you read the materia medica, your symptom is intact and it's not broken into component parts. A patient who does not like beer, tea, or meat should be given a thought for ferrum metallicum to prescribe. If he wants meat, then it is a thought for natrum muriaticum, tuberculinum, or even phosphorus. Next, Dr. Nash tells us that in ferrum metallicum, the food lies in the stomach all the day but is vomited in the night. So there will be patients who will come to you, and I had this case where he told me that the entire day the stomach is bloated, like a lot of gas, and I used to give him carbo veg, carbo veg, carbo veg, China carbo veg, and I got tired. This feeling of distension never went. Then I closely examined the case, and he told me that throughout the day I am distended, but before I go to sleep, I get a desire to vomit out. And I just kind of vomit sometimes. Sometimes it's by default that I get a vomit sensation and I feel better. This is where I gave ferrum metallicum, and the case was settled forever. His complaints got better and he's still referring patients after patients. So food lies in the stomach all day and is vomited at night. This is the characteristic of ferrum metallicum, especially in gastric complaints. Bowels feel sore as if they have been bruised or as if they have taken any cathartic to cleanse the bowels. It is so debilitated. They will be either distended or they will be either stuck up in one place, or they will be debilitated, and the stools are undigested at night. So there is a kind of a reflux at night, and all the patients who come to you with gastritis, with duodenal ulcers, who have complaints after dinner, you should think of ferrum metallicum as one of the top remedies. Undigested painless stools at night while eating or drinking, and there will be especially children who will have this symptom that they want to go to pass the stool as soon as they are eating. Half the food is done and the child rushes to pass the stools or clear the bowels. This is nothing but ferrum metallicum. Other remedies what Dr. Nash has given is croton tig, and the second is China. He compares China and he tells that China has more flatulence, but it is a tug of war between both these remedies, China and ferrum metallicum, and both antidote and complement each other. For ferrum metallicum, Dr. Nash again comes back to the same thing which he has been repeatedly telling. And if an author is repeatedly telling us something, we should be a keen observer of that in our clinic as well. And that is easily flushed face and red face. And the next symptom what it gives is walking slowly relieves, which is also the case with pulsatilla. So he gives a case, Dr. Nash gives us a case of a lady who had pain in the forearm. And after 1 week of treatment, she told that it pains the same as it was last time. And the only way she gets relief is by getting up in the night and walking about slowly. Dr. Nash gave her ferrum metallicum 1 m and the patient got cured. So this is the ability to pick up peculiar symptoms which Dr. Nash tells us to imbibe in our practice. Last but not the least, Dr. Nash tells us that he also cured a case with red face during chill and cough with vomiting of food. He has cured red face during chill or chilliness. During the chilliness, there is irregular distribution of the blood, and ferrum metallicum will have the red face. Ferrum metallicum will cure such cases. So that's all in short about this remedy. It's given in almost 5 to 7 pages in the Leaders in Homeopathic Therapeutics by Dr. Nash. But if you are having the ability to read between the lines, it is something that you will pick on and carry forever in your life to observe, because most of the symptoms what Dr. Nash tells about ferrum metallicum are observable very easily. So it is the physician's acumen which will help him pick up many symptoms in the case, which what Dr. Nash gives us an inspiration for. And if you are able to pick up these for ferrum metallicum, which we discussed in today's talk, you are going to be unstoppable. So thank you all for joining, and keep following Homeo Setu on WhatsApp, Instagram, Threads, Facebook, and YouTube. There is an interesting learning which is going to help all homeopaths.